Hey, can you tell me about the symptoms of an anxiety disorder? What are the causes and how can it be treated? It seems these days, there is just so much anxiety, especially social anxiety, with all of the stuff going on in the world. It's crazy, right?
It sure is a crazy world, and people are experiencing anxiety disorders at alarming rates. You might experience a beating heart, and your palms may begin to sweat. And when you leave the social situation, you might feel like you can't breathe. These are classic signs of panic attacks. Social anxiety disorder is not a psychological disorder that goes away in time. Panic attacks can be intense, frightening episodes. In these panic attacks, you have a lot of fear and tension, and the terror you feel is so extreme that you want to get away. Sometimes, you might be experiencing anxiety disorder symptoms for weeks, months, or even years before you realize it.
What are the types of anxiety disorders?
Well, there are a few main types. There's obsessive-compulsive disorder, generalized anxiety disorder, panic disorder, post-traumatic stress disorder, or PTSD, social phobia, or social anxiety disorder, to name a few. General anxiety disorders involve excessive and persistent feelings of fear, worry, nervousness, and tension. An anxiety disorder may lead to disruptive behavior, panic attacks, even phobias. Another type, generalized anxiety disorder, is related to chronic low-level distress and worry that interferes with daily life.
What are the causes of anxiety disorders?
Well, an array of things can cause anxiety. It's often the result of a bad situation, such as an eviction, a death in the family, a loss of a job, a breakup, a political or social situation that upsets you. Other times anxiety is the result of not knowing what's going to happen next. People with severe anxiety often have poor sleep, issues with attention, and cannot focus. They tend to worry a lot and can't just turn off their thoughts. It is imperative to establish how an individual can intervene to reduce anxiety.
What is the treatment for anxiety disorders?
There are different kinds of treatments for anxiety disorders. Some doctors may try to address specific problems with medications. But the best therapy for anxiety disorders is usually talk therapy or cognitive behavioral therapy. Cognitive behavioral therapy is a form of therapy in which a mental health therapist helps the patient recognize and challenge the negative thoughts and emotions that create the anxiety. Often patients are provided with homework assignments to practice what they learned. Other options are stress management techniques such as meditation or yoga, or even massage therapy. Many people benefit from cognitive behavioral therapy, or CBT, which can be carried out in the office or the home. I heard you mention cognitive therapy, and I've heard that term before. What exactly is cognitive therapy? Cognitive behavioral therapy is a type of talk therapy. In cognitive behavioral therapy, a patient learns to monitor thoughts and identify common emotions or thoughts associated with anxiety. The therapist will help the patient replace negative thoughts with more positive ones. The therapist will also help the patient become aware of patterns in their thought process and try to avoid getting trapped in these patterns. The point of cognitive therapy is to teach people how to recognize and modify thought processes that may create a particular kind of anxiety. Awareness is fundamental because anxiety, like any other chronic disorder, does not come and go. There are different kinds of anxiety disorders, and some are more severe and can impact everyday life. A patient may also have increased anxiety in highly familiar situations. For example, a student may be nervous about a midterm exam. The symptoms are often similar to that of obsessive-compulsive disorder, but there are differences. For example, patients suffering from obsessive-compulsive disorder don't experience anxiety during everyday activities. In most cases, anxiety disorders can be treated with medication. These can include antidepressants, anti-anxiety medication, or even anxiety-relieving supplements such as ginkgo. Medications are usually prescribed for people with moderate to severe anxiety or panic disorder. Many mental health counselors may recommend cognitive therapy, although they have a more limited range of interventions for panic disorder patients. And doctors may prescribe a combination of medication and cognitive therapy for those with more severe anxiety. Anxiety disorder is something that is not to be ashamed of, and if you feel you need help, then do not hesitate to reach out to a nearby mental health counselor. Goodbye.